Deputy Executive Director here at Generations United, and I'm happy to welcome you to this webinar. Our speakers today are Ana Beltran of Generations United and Tom Berry with the Economic Services Administration at the Washington State Department of Social and Health Services. We will be giving you some housekeeping tips here in a minute, but first I'm going to invite Ana and Tom to just talk a little bit more about themselves, and then we'll move to housekeeping and move straight into the presentation. Ana.
Thank you, Jaya. My name is Ana Beltran. As Jaya mentioned, I have been with Generations United now for over 15 years. I started as the director of the National Center on Grandfamilies at Generations United, and now I'm a special advisor. Tom?
Yeah, thank you. My name is Tom Berry. I work in the Community Services Division of Economic Services, and I'm the lead program manager for programs related to kinship care. I've been working for the department for about 15 years, and I've been working on kinship care-related activities for probably most of that time. And I really appreciate this opportunity to talk about what's happening in Washington State.
Thank you, Tom.
All right, so we just have I'm Adam Otto, by the way, with Generations United. We just have a few items of housekeeping to take care of before we jump into the presentation. So there will be a question and answer period following the presentation. So, anytime you think of a question, just feel free to type it in the question box, and we'll make a note of it and get to it then. The webinar recording and the slides will both be on the GU website and grandfamilies.org next week. And then we'll also be sending out a survey when the webinar ends, and we'd appreciate it if you would complete that. And finally, please note that sometimes, because technology, there might be a slight delay when the slides transition, so don't panic, that's normal. It should move along shortly. All right, and then turn things over to you, Ana.
Thank you, Adam, and thank you, Tom, for joining us. And finally, thanks to the Annie E. Casey Foundation, who makes this webinar and the policy brief I will mention later possible. We thank them for their support and their partnership. And that is their website there, which I encourage you to go to. There are a number of excellent resources there concerning kinship families, including their Stepping Up for Kids report that they did in 2012, which has a lot of very useful background information. So today we're going to do a number of things on this webinar. I'm going to briefly go through background of the families and the TANF issues. Then we're going to go through what we call our Kinship TANF model. It's a compilation of state and county practices, programs, and policies from around the country that we think are very promising practices that other states and counties can replicate. So we're going to go through that in addition to the results of a TANF survey that we conducted of relatives raising children and a network of support services that help them. Then I'm going to turn it over to Tom, who's going to talk about Washington State's practices, programs, and policies concerning TANF. We're going to go into some TANF practices that are of concern that we're seeing around the country. Then we're going to go into some national resources that are available to you. And finally, we're going to conclude with questions and answers and strategies that we can collectively explore to improve grandfamilies' access to TANF. And I encourage you, as Adam mentioned, to type questions throughout. I know I always think of my questions as people are talking, not at the very end. So type them at any point in the box in the right-hand panel, and Adam and Jaya will collect them, and we'll go through them at the end. So in terms of background, temporary assistance for needy families began in 1996. Congress passed the legislation that basically replaced aid to families with dependent children, the previous welfare program, with TANF. And in 1996, Congress said that one of the 4 primary purposes of TANF is to provide assistance to needy families so that children may be cared for in their own homes or in the homes of relatives. So you can see that kinship care, grandfamilies were envisioned from the very beginning and it has been one of those core purposes from the get-go. And TANF continues, all these years later, to be often the only source of financial assistance for families outside of the foster care system. So this is kind of the resource that is available to most of them. And most grandfamilies are outside of the foster care system. There's about 1 child in relative foster care for every 25 outside of relative foster care. So many more are outside of the system. And despite the fact that TANF is this sole support, very few of kinship families actually access it. Only about 12% receive any TANF assistance, even though the majority of the children would qualify for child-only grants. So very low access rates, and there are a number of reasons for that, which we're going to explore. The latest census report that was just released about 2 weeks ago, and that is a link to it. So when you get these slides, you'll be able to access it. I found this statistic very telling, that 1 out of every 2 grandchildren living just with a grandmother, no parent, no grandfather, they're poor. And only 14% of this population receives any TANF. So the poorest are still not receiving TANF. So how can we improve this? Well, we're going to talk about that. In terms of other needs of the grandfamilies, you'll see these interesting statistics. These are all from that Stepping Up for Kids report that I mentioned earlier. But you'll see that more relative caregivers are poor than one-parent homes, quite a bit more, 63% versus 43%. And unlike children living with at least one parent, the majority of children who have a caregiver, who are living with a grandparent or other relative, have a caregiver who is aged 50 or older. So this population should be saving for retirement, thinking about retirement, have more assets, all those kinds of things. And 16% of them are already retired. So this is older population than parent homes with different challenges. So now the TANF framework, even though one of the 4 primary purposes of TANF was to make sure that children could stay in relative homes and be cared for by their relatives, the actual framework of TANF wasn't really developed with our families in mind. It was developed for young, low-income, single moms with minimal financial assets. And so it has work requirements and time limits and things that really weren't developed with our caregivers in mind. So we have to keep that in mind and kind of adapt the framework. So there are 2 types of TANF grants, and there are barriers that come along with each. But the family grants, the caregiver's on the grant. There's a 60-month time limit. There are work requirements that come along with this. There are asset limits. There are limited income disregards. So the caregiver can only have so much income. It requires the caregiver to assign child support to the state. And even though the feds don't define relative, they leave it up to the states, but the states may have a restrictive definition about who can actually be on this grant with the children. As for the child-only grants, those have been envisioned only for the care of the child and only based on the child's income, although we're going to see that that's changing a bit in some states. These grants are typically quite small. The national average is $249 a month, with many states providing much less. And unlike foster care payments, for example, they don't go up proportionally with each child. They only rise incrementally for additional children. So the first child would get $249, say, but the second child might only get $80 or whatever it is, but it's only a slight increase. And it requires caregivers as well to assign child support to the state. And like family grants, the definition of relative may be restrictive. It may not include other family friends, godparents, other people that that may be raising those children. So in terms of work requirements and time limits, under the previous welfare program, the Aid to Family with Dependent Children, there were certain individuals who were categorically exempt from work requirements. And you can see these categories. If they were too ill to work, if they were over age 59, if they were needed in the home to care for a disabled household member, if they were providing care for young children. So all of these people were excluded throughout the country from those work requirements. Well, these federal exemptions no longer exist, but the states have the flexibility to exempt these groups. And many states do, and many states don't. So that is a strategy, is to look at what your state does and perhaps work for those exemptions in your state. And a theme that will recur throughout this presentation is that states have a great deal of flexibility with their TANF monies. So they can do a number of things, make exemptions. The feds really did leave it up to the states. So we can get creative and really help these families. Now, in terms of asset limits and income disregards, the typical asset limit for a family grant is $2,000. So you can see if you're a caregiver who's 50 or older, near retirement, or perhaps retired, if you only have $2,000 to your name, you're in trouble in terms of ever retiring. So this really was, the asset limit really was set with those young single moms in mind. Now, state policies often allow for these young single moms to save for a first home or college, but very typically not for retirement. So that's another huge challenge. And also those income disregards are usually not high enough for caregivers who are in middle age to continue saving for retirement. Child support enforcement, that's another big barrier. Under either type of grant, all recipients must assign their right to child support to the state. And so these can, this can be a real barrier for some caregivers, and we're going to get more and more into this. But states have the flexibility to waive these requirements for good cause if they can show that that cooperating with the state is potentially harmful. And states have varying degrees of success in making this known to caregivers and in granting those exemptions. Eligibility for victim kin, that's another big issue area. And as I pointed out, relatives not defined under the federal law. So it leaves it up to the states, and the states have the flexibility to define it to include any number of people. And we're going to get into some specific examples of that. Now, based on this landscape of TANF, we conducted a survey of the Brookdale Foundation's Relatives as Parents program. They are the largest national network of support groups for relatives raising children around the country. They're in most states. They provide other supportive services as well. They're a very active network that's been around for a long time. So we partnered with them and surveyed their network. So this network consists of professionals, mostly professionals who work with the families, but also some caregivers themselves. And we conducted the survey, and even though it was August, middle of summer, we did manage to get a 25% response rate. And we asked a number of detailed questions. This was online through the SurveyMonkey tool. And you'll see we asked them about their barriers to access, how it can be used to serve the families, and how we can improve it and improve access to benefits and services. We got a number of very interesting responses, things that really, despite looking at this for many years, surprised me. But this one didn't, because this we have heard for years, that child support enforcement is really the biggest barrier. And that is what the survey results showed, that relative caregivers choose not to pursue TANF because of having to assign their right to child support collection to the state to offset the TANF expense. And that is a huge barrier for these families. And it's a barrier because sometimes they fear retaliation from the parents. Sometimes they just don't want to cause problems for the parents because they know that these parents are trying to get their acts together and that they might not have the funds to do child support, and they don't want the state going after them. So there are mixed reasons. And you'll see that on the next slide. These are kind of a couple of the examples of more detailed responses that we got. You know that they, Adam, can you forward the slides, please? Anyway, that they don't want to get the adult in trouble. That's something that we've heard over and over. And then also that they're afraid, that they're afraid that the parent will retaliate in some way against them or the child, maybe with by taking the child, maybe by hurting someone. So there are a number of fears around this area. And then the other thing that we heard was that there's really a lot of barriers to getting any kind of exemption to this, getting the good cause exemption to the child support assignment. And you'll see this quote, the second quote, which comes from Tennessee, that shows that they have to have, this was one respondent, but said that they had to have a police report, and most families don't want to create further drama. They don't want to create further problems. So they don't want to have to go through all that to get an exemption, and they don't want to have to assign the child support to the state. So the two-pronged problem leads to a lot of families not accessing the services. So what can we do? Well, we could make the good cause exemption easier to get. And you'll see, I believe, on the next slide. Let's see, what is the next slide? Yeah. This is other reasons caregivers choose not to seek TANF. We'll get into the good cause exemption a little later. But other reasons caregivers choose not to seek TANF, you'll see the biggest reason is because they don't know about TANF. And that's how, there are a number of things we can do to improve access and to improve knowledge about the availability of TANF to these families. There's also a number of other issues. They're distrusting of government systems. They don't want to ask for help. The legal custody issue can cut both ways. They think that they have to have legal custody to get TANF, or they have legal custody and therefore they think they're responsible for the child and can't get TANF. Another big one is not related to the child, and they don't want to provide their own financial information. So there are a number of obstacles. And the legal custody and the guardianship ones were the ones that were most interesting to me. You'll see a couple of examples on the next slide. But indicating that their caregivers were told a number of things, including, oh, you have legal custody? Well, you need guardianship, even though really they're essentially the same thing. Or that they have to have legal guardianship to get the TANF. And then they put them through some hurdles to get the TANF. So there's just a lot of challenges out there that we're seeing. Some reasons that caregivers were denied TANF child-only grants on the next slide. You'll see the one that the child has too much income, that's a legitimate reason, because if the child has too much income, then they're not eligible for child-only grants. But the other things are something we can do about. Caregiver income should not be considered in child-only grants. And you'll see that there's a trend towards doing that. But Congress didn't envision that. It was child-only grants for the child based on the child's income. And that the caregiver is not related to the child is another big obstacle. That's that blue line. So that's something we can also do about at the state level, do something about at the state level. On the next slide, you'll see some examples of obstacles. That there might be a checkbox that requires the caregiver to say if they're applying for a regular grant or a child-only grant, and that often they're not eligible for the regular grants because they may have too much of their own income. But then they have trouble proving their relationship to the child to prove that relative piece. Or they just may not be told about the availability of TANF by the agencies involved. So there are just a number of obstacles, all of which we are going to try to address and give you examples of ways to address those. And the last slide in terms of these survey results are showing why the caregivers are denied TANF family grants. And you'll see that the number one reason is the caregiver has too much income, which is a legitimate reason. We can't do anything about that because that's an obstacle. But I mean, that's a federal requirement. But the caregiver must meet work requirements. States can grant exemptions, can put exemptions in place. That the caregiver is not related to the child, we can fix that. So there are a number of things here that we can address. So let's move into our model and show you how these things can be addressed. So the Kinship TANF model checklist. What we did was we created 3 categories: promising policies, promising programs, and promising practices. And under the policies, you'll see this is how we address all those issues that we just talked about in the background section. So we can reinstate the previous work requirements and time limit exemptions. That can be done at the state level. We can increase asset limits and income disregards, again, at the state level. We can make clear use of the good cause exemption. We can allow adults with a family-like relationship to the children to be eligible. All those things can be done at the state level. Promising programs. So there are a number, as I said, TANF is extremely flexible. The states have a lot of leeway in terms of how they structure it and how they use it. And so there are a number of things that can be done. They can offer subsidized guardianship, enhanced payments to our population, provide non-financial support like supportive services, make short-term benefits available. Those aren't grants. Those are just one-time short-term things. And ensure that working kinship caregivers can qualify for child care. And Tom's going to talk more about that. He's got an excellent example from Washington State. Then in terms of practices, on the next slide, combining the application requirements for TANF and other major public benefits can be a good strategy. Ensuring that child welfare and TANF collaborate. That can be a way to maximize resources and really assist these families. Hold joint TANF child welfare training. So train all those caseworkers and have them come together, conduct joint outreach, work together to reach the families. And then one of my favorites, which is provide concurrent TANF benefits for kin and parents. And the only state that we know that does that is Washington State. And Tom's going to talk about that. And we'd love to hear from you if your state does it as well. And have kinship work groups, which is a great cost-neutral way to get services to the families and to coordinate services better. And Tom's also going to talk about that aspect of our model. So turning to promising policies, we'll go through all these in order. These exemptions that I've already touched on a little bit. You can make sure that your states make these exemptions. And you can check to see if your state does first by going to the Urban Institute Welfare Rules database. They have a database on all these exemptions. I also have a chart and can help you figure out if your state, a chart that we've prepared using that data, and we can help you see if your state makes those exemptions. And then go from there and maybe get language from other states or do those exemptions that existed under federal law before. There are some states that make exemptions specific to relative caregivers. You'll see West Virginia exempts grandparents and other non-parental caretakers from work requirements. Texas exempts a single grandparent who's over 50 from caring for a child who's caring for a child under 3 from work requirements. And Connecticut exempts families with caretaker relatives in a number of situations, such as caring for a child under 1 from time limits. So there are a number of interesting exemptions out there, or you can follow the previous ones that existed under AFDC. Increasing asset limits and income disregards. This is a very interesting area, and as I talked about, most states only allow assets of $2,000 to qualify for TANF. This would be for the family grants. Well, a few states you'll see there in that first bullet allow the elderly, or those who are age 60 and older, to have $3,000 in assets. Well, as any of us approaching retirement know, that's just not enough. So there need to be more creative ways to help people continue to save for retirement and to have retirement savings. Only DC and Hawaii explicitly allow additional assets for retirement. Though most do allow for college or for saving for a first home. They even have what are called these IDA accounts, which states will often match the savings and for those kinds of purposes. But only those 2 states explicitly allow savings for retirement. So again, really that framework of TANF just not considering our population. But there are, states can increase these asset limits. They can encourage savings for retirement. They can match those savings. There's a number of things that can be done. And they can also increase the income disregards. So those middle-aged people and elderly that are still working can continue to save for retirement. Make clear use of the good cause exemption, as we talked about earlier. So the federal government allows states to make a good cause exemption to complying with child support and assignment. So caregivers, if they have good cause, don't have to assign their child support to the state when they get a TANF family or child-only grant. The problem is most caregivers don't know about this exemption. It's not well known. That's definitely what we heard through the survey, and that it's just kind of a secret that's kept. Well, D.C. is very clear in its language. They've got it in their application form and in their law, and it's just right up there in the form itself in pretty large letters, and it says that if you're afraid that an absent parent might hurt you or someone in your family, then you have a good reason. So really making it clear up front what this exemption is, how they can get it, what's the process, that will go a long way in improving access for these families, because as we saw, this is really the biggest issue and the biggest barrier for the families, that the reason they're not seeking TANF. So really make it clear and make it clear up front. And then finally, in terms of these policies, allowing adults with a family-like relationship to the children to be eligible. So by this we mean many godparents, family friends, neighbors, people who are like family but they're not related by blood marriage or adoption are raising children instead of parents. But many of these caregivers cannot get access to TANF grants, TANF family grants or child-only grants. So at least 4 states allow adults, sometimes they're called victive kin, to be eligible as caregivers on family grants and to receive the TANF child-only. A few other states have some more limited inclusion. You'll see those examples there. Those states, in the first bullet, they have to have legal custody or guardianship of the children in order to be included. And in Alabama, there's a provision where they can be the grant payee for up to 90 days if there's a crisis or an emergency. But that's something that all states can do. They can look at their definition of relative, make it more inclusive, make it more culturally responsive as well, because a lot of tribes, which Tom will mention, a lot of Latinos, a lot of African Americans, they come together, and there's a proud tradition of raising each other's children, and we need to be responsive to that and help support those families. Now, promising programs. This is the next element of our TANF kinship model. And one thing that can be done is offering enhanced payments for those outside of child welfare. So this is using the TANF funds to offer some kind of additional assistance using TANF. And Louisiana is a program that's existed now for a long time, 15 years, and they have grown it a couple of times, expanded it a couple of times since '99. They extended it once. It used to be just grandparents, so they extended it to include other relatives by blood marriage or adoption, and then they extended it a second time to include not only those relatives that have legal custody or guardianship, but also to include those that have provisional custody by mandate. And that's essentially a power of attorney where the parent conveys authority over the child to the caregiver. So this is for low-income families, and it's more than the state's child-only grant. No parents can be in the home. But these are the kinds of programs that can perhaps be responsive in your state to these families, and that TANF allows the flexibility to you to design whatever you think would be most helpful for the families where you live. Now, we did find in the survey, and you'll see on the next slide, that most states and counties don't provide these kinds of programs that Louisiana provides. But they can. So, you know, that's just another strategy to look at. Providing supportive services is the next slide. This is something that Tennessee started doing a number of years ago using their TANF funds. It was so successful that now the state took it over with state dollars, and they're basically their TANF and their child welfare departments collaborate, and they serve, you'll see, thousands of children each year. This is also for low-income households, but the caregiver does not have to have legal custody or guardianship of the child. And the services include all those things you'll see listed there. So support groups, which is shown to be so helpful to caregivers, respite, tutoring, mentoring, startup one-time emergency financial assistance, child care, case management, information and referral. So it can really TANF can be used to provide these kinds of services as well. You can tap into that for helping the families. But you'll see on the next slide that as our survey results show, most states don't do this. So you can use the Tennessee example if you think that would be something that would respond to caregivers in your state. Now, making TANF one-time benefits available. These are benefits that aren't subject to work requirements or time limits. They are they're just one-time payment, one-time assistance, one-time help, I should say. And it depends on how the state structures it. It can cover anything from utilities, payments, to burials. And sometimes this is just, most states take advantage of this, and sometimes it's just a matter of tweaking the language to help our families. Just making sure that they're considered as part of the eligible population. There have been some states that have targeted this for kinship families. New Jersey did. So this is something else to look at, and really having some inclusive language. It doesn't have to be targeted just for kinship. It can just be that kinship's part of the pool. I'm reminded of a story from years ago when we were working on CHIP, the Children's Health Insurance Program, and improving access for that. And this very large national nonprofit that does great work, they'd done flyers trying to promote the availability of CHIP, and they just honestly forgot about kinship families, and they weren't part of the flyer. It just talked about parents. And that was an honest mistake from someone, from an organization that definitely wanted to help kinship families. So sometimes it's just a matter of tweaking language and making sure caseworkers know that it's available to kinship families. You'll see on the next slide that our survey results showed that most grandfamilies aren't getting this one-time assistance. So this is definitely another area where we can help improve services and supports for the families. And then finally, under the programs element, is ensuring that working relative caregivers can qualify for child care assistance. This is something we hear about repeatedly. We've done a number of surveys over the years, and just anecdotally talking to many people. And child care is a big issue because many of our caregivers are still working, and they need that support. And Tom Berry is going to give you an excellent example from Washington State in a few minutes. I need a drink of water, excuse me. It's odd talking for this long straight. Anyway, promising practices. This is the third element of our TANF kinship model. And practices can, in looking at the states, we identified a number that can help improve access for grandfamilies, one of which is combining the application forms for TANF with other major public benefits like food stamps, SNAP, or medical assistance, Medicaid, or CHIP. Now, these forms have to be well done because, for example, I've been hearing lately from New York that they have issues with their combined application form because they don't make it clear that caregivers don't have to disclose their financial information if they're not applying for SNAP. So there's a lot of confusion around the form. There's asking for more information than they need to provide. So the forms have to be done well and created clearly and not be too lengthy or onerous. And Minnesota and the District of Columbia have forms, combined forms, that I get very good feedback about, that they work very well. And then there's less paperwork for the families, and there's more knowledge about those other programs that maybe they might not hear about otherwise if the form wasn't combined. So that is a strategy that can help the families. And you'll see that most states actually do use this strategy on the next slide, at least of the states that responded to us, which were a number of states. So that's good news. Now, ensuring that child welfare and TANF collaborate. This was a big theme in the 2011 GAO report, Government Accountability Office report. Why does that seem like that's the wrong acronym? But anyway, the GAO report from 2011 really made a big case for TANF and child welfare collaborating. and that caregivers can get financial assistance through TANF and services through child welfare, even if they're not in the child welfare, in the legal custody, the children aren't in the legal custody of the state. So there is a way to collaborate across your agencies to maximize your resources and reach more families. Now, El Paso County in Colorado has been doing this for a long time. They were really a trailblazer in this area, and they're still doing it. There have been a number of changes over the years, but they've still got this integrated family services team, and they help grandfamilies outside and inside the child welfare system. They provide wraparound services to the families. They make sure they get the TANF child-only grants. Next slide, Medicaid, child welfare services, like I talked about, and the supported assistance that can include a number of things. So they can really do a financial analysis of the families and try to figure out ways to target help for them. They can also help with the rent or security deposits. Next slide, please, Adam. They can provide, they even use their TANF funds to provide a support group for the caregivers, which, as I mentioned earlier, can just be huge because it not only provides a forum for them to share their joys and their problems and their challenges, but also it kind of usually elevates to a resource sharing venue. So they really let each other know about the resources that are out there in the community like TANF. So that is a model that's existed for a number of years, and we're seeing more and more states doing that and collaborating across agencies. Colorado, next slide, is also at the state level. They've developed a curriculum, and they're cross-training their child welfare, their TANF, and their child support teams at the county level. And they've done this a number of times now, and they hope to do it more times. And its goals, as you can see, are to identify the experiences of these kinship families across the programs, to learn strategies for how to work with these families in multiple programs, to figure out how they can improve, and how they can develop a plan to provide seamless services to the families. So that is another strategy that you could look at in your state, is really figuring out who to train and training them on all the supports that are available to the families and how they coordinate those supports. Because oftentimes what we hear is there's just a lack of information at the frontline caseworker level about grandfamilies and about how to serve them and about how they qualify for TANF. We see on the next slide that there's really a lack of useful information, a lack of useful, oh, pardon me, another strategy to implement is conducting joint TANF and child welfare outreach. And New York did this a couple of years ago. They developed an administrative directive, and they basically told counties that they needed to make key information available to grandparents and other relatives raising children about the TANF and other income supports. So the agencies work together, the child welfare and the TANF agencies work together to get the word out. And they also work together on a handbook for the families, and you'll see the link there. So really work across the agencies to get the word out about TANF, put the materials in those offices, let them know, work together, all great strategies. And you'll see on the next slide that there's a lack of this happening. There aren't very many useful materials. I love this quote on the right-hand column, that it's held like a state secret, basically TANF child only, that basically and this was a fairly high-level state person, and that it was just really held like a state secret. And you'll see that there just really aren't very many materials letting people know about TANF. You know, the no line is the most prominent line. They're down below in green. The website and the phone numbers are the most prominent, but there's still just a real lack of useful information out there and a lack of knowledge about TANF. And you'll see on the next slide that there really is this need to collaborate. And that the TANF agency, that green line down at the bottom, that they're just really not getting the word out through other agencies. And that's a big strategy, which is just put these materials where the caregivers are. So in the schools, in the pediatricians' offices, the places they go with these children, and really let the cat out of the bag and not hold it like a state secret, but let these families access this support so that they can better meet the needs of the children. Because frankly, most of us couldn't take on an extra child without some additional financial assistance. Now, there are several remaining elements, well, at least there are 2 remaining elements of these promising TANF practices, and I'm going to, that are part of our TANF kinship model that we got from Washington State. So I want you to hear it directly from the horse's mouth. So I'm going to turn it over to Tom. Tom?
Yeah, thank you, Anna, for providing that excellent context to what I want to say. So in the time I have, I'd like to talk about what Washington State has done to take advantage of the flexibility that Anna mentioned that's built into the TANF law to shape the program for the benefit of kinship caregivers. And in addition to the 2 promising practices that Anna mentioned, I'm going to talk about several other aspects of the TANF program in Washington State. So next slide, please. So first off, just want to touch briefly on the good cause issue related to child support. As Anna mentioned, the concern about child support enforcement is one of the major barriers for many caregivers accessing TANF. In Washington State, our rules are pretty clear in regard to the good cause exemption to child support enforcement, and that first bullet is a direct quote from our from the rules that govern that policy. Any caregiver who is fearful of possible physical or emotional harm can make a claim for good cause, and as soon as they make that claim, they have 20 days in order to provide some kind of proof for their fears. Benefits continue during that time. And the third bullet is really important because we don't, unlike some other states, we don't require any particular kind of proof. In other words, it doesn't have to be a police report. It can be, for instance, a statement from a pastor or a clergyman attesting to the family situation and to the fear of retaliation from the parent. So any sort of proof that a reasonable person would consider legitimate, we have to accept. And on top of that, if the caregiver is in a position where they need help getting that kind of proof, and they ask us for it, then we're obligated to help them get that proof. Next slide, please. So Anna mentioned the effective kin issue. Washington State is one of a handful of states that allows so-called fictive kin to receive child-only grants on a child's behalf. Most other states that do this require some sort of legal relationship, like third-party custody or guardianship. Washington State doesn't require any sort of a legal relationship between the non-relative and the child, but we do, for non-relatives without any sort of legal relationship, we do require a criminal background check. And this is a standard highway patrol background check looking at felony convictions, and it includes a check of CPS child support findings. So it's a pretty basic background check. So a non-relative who passes that background check would be eligible to receive a child-only grant. Next slide, please. In terms of one-time assistance, Washington State, two things that Washington State does. For those families that are already on TANF, including child-only families, we provide an additional, the option of an additional grant up to $750 or more on a case-by-case basis during a 12-month period. And this is usually used for shelter-related expenses. For instance, if a caregiver has to move into a larger home or apartment in order to care for a child or children, or if there's an unpaid utility bill, it can be used for this, this kind of purpose. And this is paid for with a mixture of TANF and TANF maintenance of effort dollars. So in addition to that, and this is outside the TANF program, our state legislature has authorized an annual budget of $1 million for what we call the Kinship Care Support Program. These funds are distributed around the state through the area agencies on aging to meet a variety of kinship care needs. It could be anything from paying for summer camp or buying furniture or school clothes, or the range of needs that can be covered is quite great. And both, it doesn't matter whether the family is receiving TANF or not. It serves, the program serves both TANF and non-TANF families. Next slide, please. Regarding child care, Washington State has a subsidized child care program, which most, if not all, states do. We prioritize TANF recipients, whether they're receiving a TANF grant or a child-only grant. So this means that even when funds are short, which has happened sometimes, TANF families, including child-only TANF families, are always guaranteed the child care subsidy. An important feature of our program that if you have two relative caregivers, let's say a grandmother and grandfather caring for a child, only one of them must be employed outside the home to qualify for the subsidized child care. So even if you have one of the caregivers at home, they can still be eligible for the subsidized child care. Next slide, please. So, and our concurrent benefits program is Anna mentioned earlier. As far as we know, Washington is the only state that's doing this right now. I'd like to give you a little history about this. Back in 2008, when this policy was put into place, one of the members of our state legislature basically raised concern about the fact that when TANF children were being removed from their parents, that the TANF grant to the parents was ending in situations where there weren't any children left in the home, which is most situations. And this member of the state legislature expressed concern that this was creating an obstacle to reunification of the child with the family. It could lead to loss of housing, for instance, which would make it that much more difficult for the parent to get their child back. So up until that point, we had assumed that TANF law would not permit us to pay concurrent benefits, but we we checked with our regional ACF office, Administration for Children and Families, and they told us basically it was up to us, that we could continue to pay the parent a TANF grant, and at the same time pay a relative a child-only grant at the same time. So basically paying the child to be in 2 different households at the same time. So back in 2008, we instituted this concurrent benefits policy. It's basically aimed at situations where the reunification is the goal. The absence is expected to be temporary, not more than 180 days, with extensions based on individual circumstances. And the reason, the rationale for the financial assistance is that it helps, it makes sure that financial reasons, including things like maintaining shelter, are not an obstacle to reunification of these families. To give you a sense of the scope of the program, in state fiscal year 2013, about 900 TANF families in Washington State received concurrent benefits payments, which was approximately two-thirds of the TANF families who had a child removed during that same fiscal year. We've also done a little research internally, and our research office did a pretty detailed study and concluded that the receipt of concurrent benefits is associated with a significantly more rapid reunification of children placed in out-of-home care. That is, reunification with their biological parents. Next slide, please. So Anna wanted me to talk about our kinship work groups in Washington State. We basically have 2 different levels of kinship work group going on. We have one which operates at the level of the state agencies and includes key staff from our Economic Security Department, the Child Welfare Agency, the Aging and Disability Agency, Department of Health, Department of Learning, and my department, which runs the TANF and food stamp programs. And this committee basically, or work group, serves as an opportunity to strategize different ways to coordinate services to kinship caregivers. Next slide, please. We also have a state legislatively mandated Kinship Care Oversight Committee, which also includes key staff from relevant state agencies, but by law must include 30%. 30% of its membership must be kinship caregivers. And it also provides, includes representatives from the kinship care advocate and service provider communities. And the committee has been instrumental, as the slide notes, in developing the Kinship Navigator program, the state's healthcare consent law, and various other initiatives. And I should add that ideally these 2 work groups work in tandem with each other, and that is that the Oversight Committee may identify issues and then pass that on to the agency work group to try to work out specific solutions to the problems identified. Next slide, please. So no discussion of kinship care in Washington State is complete without talking about means testing of child-only benefits. Washington is now one of about a half a dozen states around the country that are now attached an income, but I should note, not a resource test, to the child-only TANF grant. And this was basically a result of the budgetary concerns, tight state budget secondary to the national recession. In 2011, the legislature passed a law requiring caregivers to receive a child-only grant to have income no higher than 300% of the federal poverty level. And the legislature also established a sliding scale for caregivers with income between 200% and 300% of the federal poverty level. So caregivers with income below 200% of FPL, which is our SNAP or food stamp threshold, eligibility threshold, would get the full TANF grant. At the time we applied, our standard TANF rules is to disregard or discount the income of 50% of all earned income, but to count dollar for dollar all unearned income, including retirement, Social Security income. And in 2014, the legislature went back and addressed this inequity by applying the 50% discount to both earned and unearned income. And I should note that this was a request from our department to the state legislature, and it was passed with strong bipartisan support, so that currently the means testing threshold in Washington State for kinship caregivers is quite high, as you can see. Next slide, please. So in terms of the consequences of means testing, at the time the law went into effect in 2011, over 1,000 children were cut off from assistance, and there have been a steady stream of children who lost assistance since then. And the important thing to note is that over 90% of the caregivers and children who lost assistance did so not because we know that they were ineligible based on their income, but because they did not provide the income and household composition information that we needed to determine eligibility. And I think this is understandable given that up until that point, caregivers were not used to having that kind of government intrusion into their personal financial affairs. And it also suggests that we're at whatever level the income threshold is set for means testing child-only TANF, the issue of intrusion and the willingness of caregivers to share that kind of personal financial information is still going to be an issue. So I think that ends my comments, and we'll be answering questions at the end. Thank you.
Thank you so much, Tom. Just to piggyback a little bit on what Tom ended there with, we are seeing a disturbing trend of counting caregiver income towards child-only grants. This wasn't envisioned by Congress. Child-only grants were only for the child, based only on the child's income. That is what was envisioned. And this new trend is short-sighted. I mean, it could lead to other more costly expenses for the states. If these families aren't supported outside of foster care, you could see more children entering foster care, which costs much more than TANF child only. As you saw, TANF child only about $249 a month on average. Foster care payments are about $511 a month on average. So it's a lot more money, and if these families can't stay together for lack of financial support, then that's what a likely outcome would be. You'll see, according to Urban Institute, the states that are counting caregiver income. We know Oregon's also counting caregiver income. So this is a trend that we hope stops soon. Another issue that we're seeing is imposing time limits for child-only grants. You'll see from that report that I mentioned earlier, that GAO report, and that's a link to it, that they found that a few states were subjecting child-only grants to time limits. Hopefully that is something that will not grow as well. And then finally, the last disturbing trend that we're seeing is placing children in unlicensed foster care with TANF as the only source of support. So basically, these are children who are in state custody, but their relatives are not licensed. So instead of getting the increased financial assistance, the increased support, the access to the permanency option of guardianship and the guardianship assistance program that exists in many states around the country, these children are in unlicensed care, and they're referred to TANF for, the families are referred to TANF for the only kind of assistance. So that's the last disturbing trend I will mention today. I want to end with some resources that are available to you for free. On the next slide, you'll see our policy brief, which goes into everything that we discussed today, but in greater detail. And that is available on both those websites at the bottom. There's also an executive summary of this that's about 3 pages long. In addition to those 2 documents, there is a short fact sheet that we wrote for the caregivers themselves, along with the chart, because TANF is called many things in different states. We have the chart says the name in that state, along with contact information and websites for that state, so that caregivers can access TANF in their state. And then some additional websites and resources that are available are, of course, our website at gu.org, the grandfamilies.org website, which, if you're not familiar with, it's got a number of resources available for grandparents and other relatives raising children, in addition to this database, including this database of state laws and legislation that can be searched, and it's state laws around the country. Grandfactsheets.org is, if you go to that link, there's a drop-down menu. You can select your state, and it'll provide some programs and policies in your state that are state-specific. Those are a little bit outdated, unfortunately, but they provide a good starting point. And then last but not least, the Brookdale Foundation website, which is that large network of support groups and supportive services for the families that I mentioned earlier, and the aarp.org quick link, which allows caregivers to type in their information specific to their family, and the program, the database, will kick out federal programs, state programs that they may be eligible for. So it's a nice tool to let the families know about to improve their access to programs. So with all that said, and I hope we haven't overwhelmed you, and opening it up for questions, whatever you'd like to ask us.
Great.
Jaya?
So thank you to Anna and to Tom. This is Jaya again. We have been assembling the questions as they come in. Thank you to all of you. We don't have a lot of time, so I just want to iterate that if your question does not get responded to on this call, you can send it along to myself or Anna Beltran, whose contact information I believe has been shared. Or will be on the last slide. We will, why don't we go ahead and move to that slide now. So you can make sure you have that contact information, but we'll get to as many as we can. First, a number of you asked about getting the PowerPoint presentation and the recording of the webinar. We will be posting it to our website after this session, but we also will be emailing you within 24 hours after the completion of this webinar. All of you that were on the webinar will get an email with a link to the PowerPoint and the recording of the webinar. So you will receive that information for those of you that are requesting it. First question I'll direct to Tom, and that is a question about how in Washington State you train frontline caseworkers on TANF policies related to relative caregivers in your state.
Well, that's a good question. We don't do any of the kind of cross-systems training at this point that Anna mentioned, like they're doing in El Paso County, Colorado, and some other places as well, although we're thinking about doing some of that. Regarding, for instance, concurrent benefits in particular, that's a policy that involves close collaboration between the child welfare and TANF systems. And so we have headquarters staff in constant communication about that policy, and we actually are in the process of putting together an online training for frontline staff about those concurrent benefits cases. But there's no, in terms of the overall system, there isn't really any systematic training of our frontline staff around the needs of kinship caregivers. Over the years, we have done some joint, we've had joint meetings in different local parts of the state, including frontline staff from the child welfare system, the TANF system, and then the local kinship navigators. We've done joint meetings like that in different parts of the state to create networking opportunities and to make sure each of those entities is familiar about what the other has to offer. I think that's the best I could do to answer that question right now.
Okay, great. Thank you, Tom. Then I just want to share a comment that we got from the field. One is that we hear that Vermont actually does have the option for parents and grandparents to concurrently receive TANF for 180 days if there is a reunification plan. So we just wanted to convey that information that was shared by one of our participants. We also had another comment just simply saying that some states are jealous of what's going on in Washington, so kudos to the work that's going on in Washington. There's a question about the decision to test the caregiver income in Washington State. Income would actually save the state dollars before the decision.
I'm sorry, you're breaking up.
While Jaya is figuring out that technology, I want to add something here. In terms of the Vermont comment, thank you very much. And we'd love to hear from any others of you that have what you consider great TANF practices, programs, or policies. Please email them to me. We're still collecting them. We still want to promote them, still give other states and counties great ideas. We can learn from you, so please share. Jaya, have you fixed your phone?
Hi, can you hear us?
Yes.
Okay, sorry, we didn't realize we had cut out. So thank you, Anna. So the other question was, did the legislature have research in Washington State that showed that testing caregiver income would save the state money before requiring it? And did that recommendation actually come from your department, Tom, or elsewhere?
In terms of the concurrent benefits, is that a question related to concurrent benefits?
No, I think it was testing caregiver income for the child-only grants.
Oh,
yes.
Okay. That it might have a cost in terms of foster care. Well, no, they didn't. We weren't able to provide, and I don't think that the legislature had access to any hard evidence about that. There's certainly a lot of people have argued against means testing on that basis, but it's kind of a hard thing to prove. Some members of our legislature, in the aftermath of means testing, some members of our legislature have asked us for data about that would indicate a boost in the number of children going into foster care in the aftermath of means testing. And our data hasn't really shown anything to report in that regard. It's a hard thing to document.
Thank you. So there were a number of comments related to accessing child-only grants, some concerns that information is often not shared at the local level about the existence of child-only grants, even when asked about it. So I think there's some interest in strategies for outreach around TANF, and just want to mention that we are working on pulling together some of that information. Our survey did ask some questions about outreach, so I'm hopeful that we might have some more information coming out of Generations United related to strategies for outreach, so thank you for raising that point. I think that there might be just time for this one last question. Those of you that we haven't gotten to your questions, feel free to send them directly to us. I understand that if there's at least one person that's not able to see the PowerPoint slides, so if you can't see them and you're looking for an email with a question, I would suggest Anna Beltran at abeltran@gu.org, or myself, JLENT@gu.org. That's Jaya. So we'll end with this last question, which is a big one, which I think is probably for Anna, but could go to Tom as well. And that is that there's a lot of discussion about inequity between foster care and kinship benefits, and just how do we get beyond the obvious unfairness and do more to equalize the benefit?
Yes, we hear that all the time, and Minnesota has done some work along those lines, and they've made some progress with what they call their, I believe it's their North Star legislation, but we can get that to you and share that with you. You know, it's a matter of money, and in these days of state budgets being limited and just limited resources out there, and there's so many more children that are outside of foster care. The inequities are just bound to continue, I'm afraid, because we just can't provide, you know, the budgets are just limited to provide the same level of support to those outside the system as those inside the system. And that's the bad news.
This is Jaya, and I'll just add to that. I think that we're always trying to balance, you know, oversight with supports. And the more supports individuals want, the more the government wants to intrude in people's lives, right? And so I think that that's the balance that we're always looking at here with foster care and TANF. So we're doing a couple of things. For those relatives that are interested in being licensed, we've released recently these model family foster care licensing standards, which are supposed to be, you know, better for relatives that desire to become licensed foster parents, because we know that there's a lot of unnecessary barriers there. So making it more possible for relatives to be licensed if they desire to do that and are appropriate to be licensed. But we also have to look at ways to work better, as Tom and Anna have been speaking about, of partnering between the child welfare agencies and the TANF agencies to make sure that we're getting effective supports and doing proper referral when the TANF route is a better way to go. And I think we need to watch those states that are doing really interesting, innovative things outside of the system. You know, Anna mentioned Louisiana, some creative things happening in Tennessee. Washington, D.C. actually has one of the only caregiver subsidy programs for those caregivers that are not licensed foster parents but get direct support in that way. So I think they're worth watching. And then finally, I think from a policy advocacy standpoint, if we're going to be arguing for more support and more equality between those outside and inside the system, we need to be really working on getting better data on how children outside of the system are faring with relatives. And that data, you know, we believe they're doing very well. We have some limited data that's saying very good things. But we're not as good at collecting data on those families because there's not as much government oversight. So the more that we can gather that research and get more information, the more strongly we can make the arguments to support families with dollars, both outside the system and inside the system. Okay, and I think with that we have gone over by 2 minutes, so I'm just going to turn it back over to Anna and Tom to see if you have any last remarks before we move forward and wrap up the webinar, knowing that folks can answer any unanswered questions. Our apologies directly to Anna or myself or Tom.
Thank you, Jaya, and thank you, Tom, for joining us today, and thank you, everyone, for participating and being part of this webinar. And do share anything that any questions or any promising practices that you have with us. I encourage you to reach out to me. Thank you. Tom?
Yeah, well, I just wanted to thank you both for the opportunity, to thank Generations United for the opportunity to be on this webinar today and to have this dialogue. And yet I look forward to any questions that participants may send my way.
Great. Well, thanks again to everyone. And again, we'll remind you that we will be sending an email with links to key resources related to this presentation and to the PowerPoint and to the recorded webinar. We can also send you links to the Model Family Foster Care Licensing Standards that we just mentioned. And feel free to email us if you have other requests or questions. Thanks so much for joining us today.
Thank you all.